So vitamin C is an excellent skincare ingredient, and it's something that I use all the time in my skincare routines for my patients, but it's not a heavy lifter when it comes to hyperpigmentation. When it comes to hyperpigmentation, I look for different ingredients like tranexamic acid, kojic acid, niacinamide, azelaic acid, and some of the newer ones on the market like thiamidol and melasyl. So these are the things that I look for as heavy lifters when it comes to hyperpigmentation. Vitamin C can be a great adjunct, but it wouldn't be my first choice as a primary treatment for hyperpigmentation.
On today's episode, we have Dr. Heather Woolery-Lloyd. She is board certified in dermatology and lifestyle medicine. She completed her undergraduate studies at Georgetown University and then later went on to medical school and even was chief resident of her residency program for dermatology. Dr. Woolery-Lloyd is an internationally recognized dermatology and wellness expert. She speaks all over the country to not only consumers, but also to medical providers, dermatology providers. She lectures on healthy aging strategies and skincare and wellness, and she participates extensively in clinical research trials and is an investigator for dozens of FDA trials, with an emphasis on including skin of color patients. She's also the creator of DermFriends and one of my absolute favorite newsletters. If you are interested in skincare, you're a skincare content creator, or you're a skincare expert, this newsletter is honestly invaluable. This platform combines technology with education to help people find the best products for their dermatology needs. Today, we're chatting all about adult female acne, how she approaches it in her patients, how she approaches her skin of color patients differently. She's giving us a hyperpigmentation 101, giving us the most common causes, lifestyle factors that affect hyperpigmentation, aging, and skin health. There's so much information here. I mentioned in the beginning of this episode that anytime I speak to Dr. Woolery in a clinic or on the phone, we'll chat, I learn something new every single time, and I always feel so inspired after talking to her. Of all the dermatologists I know, she is the one who's she has her finger on the pulse of the newest research, the newest ingredients. So you guys are going to get a taste of that today, and I'm also going to leave a link below where you can sign up for her newsletter. So without further ado, let's talk to Dr. Woolery-Lloyd. Dr. Woolery-Lloyd, I am so excited to have you on today. This episode has been a long time coming.
Yes, I'm so happy to be here.
Yeah, you are just a wealth of knowledge, and every time we speak, at the clinic or on the phone, I learn something new in every single conversation. So I just wanted the audience to kind of get a little piece of that and understand. You have just such a brilliant mind, so I'm really excited to bring all this information to the audience. And I like to start every episode asking my guest, what is your first skincare memory?
So my first skincare memory, this is such a good question because I'm remembering when I was a little kid, my sister is 11 years older than me. So she had skincare stuff and I would get into all of her stuff. And I don't know how long ago it was, but I must have been around like 10 or younger. There was this mask that was like Elmer's glue. So you put it on and you peeled it off, almost like glue. And I loved it, or almost like rubber glue, rubber cement. I don't know what it was, but it was a really cool mask. And so that's my very first memory of, I remember how it smelled. It was just kind of a cool thing back then.
And now I know that, because you're so clinical, I think your approach to skincare is much like mine. It's very simplified. You don't want any fluff. You only want the stuff that's going to actually work. How extensive is your routine now?
So I have probably the simplest skincare routine in the history of skincare routines. So in the morning, I cleanse and I put on sunscreen. I usually use a little bit of concealer because if my sunscreen isn't tinted, I do want some tint because that protects us against visible light. So I'll mix in a little bit concealer with my sunscreen to give me basically a tinted sunscreen. Mm-hmm. And at night I cleanse. I'll use a treatment product. Usually I'm trying to focus on achieving an even skin tone. So I'll use a product with ingredients that's really focused on that, and then a moisturizer. So I really simplify things. I sometimes will add a retinoid in there, but I can be a little bit sensitive, and I'm really focused more on uneven skin tone. So I try to use products that focus on that.
Absolutely. I think this is a good lesson too, and kind of instead of going with the trends, understanding what your skin needs, because I've seen photos of you at your wedding and you have not aged a day. So fine lines, wrinkles, that's not really your concern. So you're kind of leaving the heavy lifting to the products that are going to address what you are actually really concerned about.
Yes, for me, my number one concern is achieving an even skin tone. And so every step of my skincare routine includes ingredients that focus on that. And I always tell that to my patients. So there's no one perfect skincare routine. There's a perfect skincare routine for your needs. If you'd asked me the same question 10 years ago, I had adult acne. Now that's finally resolved somewhat. But I will say that then my skincare routine would have included ingredients that helped with acne and would have had a prescription acne treatment in there. So your skincare routine is not static. It will change over time as your skin changes. I used to have adult acne, now I don't. So now I really just focus on pigment and making sure my skin is as even as possible.
I'm glad you brought that up because I do really want to focus on hyperpigmentation because there's just so much new in the area. But I want to touch quickly on adult acne, especially adult female acne, because that is one of your areas of specialty. How do you approach that with your patients? How do you approach adult female acne?
So in my practice, I see a lot of adult women with acne. The first thing I do is I really emphasize to my patients, they're usually very frustrated. So I emphasize that it's okay to be angry, be frustrated with acne, because most people think of acne as a disease in teenagers. It's not. At least in my practice, most of my patients with acne are adult women. So the first thing I do is focus on reassuring patients that, it's okay to be frustrated. And, sometimes people are like, I don't know, I feel so bad that I have this acne and I know it's just acne. And I always say, stop right there. Your feelings are validated. It's okay to be frustrated with acne. Then when I approach patients, I typically am writing prescriptions, obviously. So generally they're using a medicated cleanser in the morning, a topical prescription in the morning. I used to use a lot of topical dapsone. There's some newer agents like clascoterone, which works on the hormonal component of acne, that's topical. And then there are combination products with benzoyl peroxide and antibiotics. But typically I'm either using topical dapsone or clascoterone in the morning, and then a moisturizer with sunscreen. That's very important because the moisturizer with sunscreen helps with pigment. It prevents hyperpigmentation that people complain of from acne. And then at night, those patients are typically on a retinoid. There is a new acne treatment, really, really exciting. It's a triple combination. It's a retinoid with adapalene and clindamycin. The results in the studies are spectacular, so it's really exciting for me to use that in my practice. And a moisturizer at night. And when I talk about skincare in my acne patients, I emphasize that the skincare is just as important as the prescriptions. And they've actually done studies that have shown that using really good complementary skincare improves acne outcomes and also decreases side effects. So I really emphasize to my patients, just as important as this prescription at night is this moisturizer that we're going to pair with that prescription.
That is, I think, very rare amongst dermatology providers. I actually just did a video about this because so many times in my DMs, I'm sure you get this too, they're just given a prescription and sent out the door with zero education, no routine to surround that, prescription product. And that can really be a recipe for disaster, especially when you're treating acne, because some of these ingredients can be a little bit harsh on the skin. So if you don't know how to use them and with what, it can really make or break your routine.
And also it improves outcomes. I just did a lecture. I was in Peru last week, and I was speaking about acne and the skin barrier. And we don't think of in dermatology acne as being a skin barrier disease, but the studies show it is. So it shows that patients with acne have higher transepidermal water loss, they have lower hydration, they have a higher pH, and those three factors that influence our skin barrier can be improved with really good skincare. So really good moisturizers, pH balanced cleansers, all of those things can repair the barrier that's already disrupted in an acne patient at baseline. Then when we add in our prescriptions, we further disrupt the barrier. So I think skincare is just as important as prescriptions when we treat acne, because those patients at baseline have a disrupted barrier.
Absolutely. Yeah, it's essential. So I want to get into hyperpigmentation. As I mentioned, you are an expert in this area, also for hyperpigmentation and skin of color. So I want to touch on all of that. But can you give us a little bit of a hyperpigmentation 101 and what are the most common types that you see in your office?
So in my practice, the most common types of hyperpigmentation I see are melasma and post-inflammatory hyperpigmentation. So melasma is a chronic skin condition. People usually have melasma for decades, unfortunately, but we can manage it effectively with really good treatments. And that's one of the most common and most challenging things I see in my practice. Post-inflammatory pigment are the dark spots that we see from a mosquito bite or a scratch, but also from acne. That's probably the most common reason people get post-inflammatory hyperpigmentation, and I see that so commonly in my practice. And then the third thing I didn't mention is uneven skin tone that just happens with aging. So people with skin of color are less likely to get fine lines and wrinkles and more likely to complain about uneven, dull skin as they age. So that is a common complaint that I'll see in my practice.
And when it comes to hyperpigmentation, we're obviously going to get into the skincare and the ingredients we can use, but are there any lifestyle factors that affect this?
Yes, so of course the biggest lifestyle factor is wearing sunscreen, sun exposure. If you're out in the sun and you don't wear sunscreen, your hyperpigmentation is going to get worse. I always tell patients, if once I treat your hyperpigmentation, if you're not wearing sunscreen, it's like pushing a rock uphill. So you really have to wear sunscreen. But things we don't think about often are pollution. So there are definitely studies in Asia that show that people who live in more polluted environments are more likely to get dark spots and hyperpigmentation and certain signs of photoaging. So that's something that we can't really control. It really depends on where you live, but it's something that's definitely influenced by these outside factors that we don't commonly think of. And then, of course, for overall skin health, I'm a big proponent of lifestyle when it comes to skin and, our overall skin health. And definitely studies show that hydration, signs of aging, fine lines and wrinkles are less likely in people who have a healthy diet. So that's a high diet rich in fruits and vegetables, lean proteins, just all of the healthy things that we know we should be doing.
Yeah, absolutely. I think it's easy to overlook that, especially when we put so much emphasis on our skincare routine, and it's obviously very important, but we kind of start to get into this mindset that it's the only thing that matters and that what we're doing outside of our, bathroom vanity can't possibly have an effect on our skin, but it absolutely does.
Oh, it does. And the studies show that. I mean, we just need to eat lots of vegetables, even things like getting enough sleep. That's something that we don't talk about so much. I always say sleep is the underdog of wellness, but the studies have shown that people who sleep better have less, we know that, we say beauty sleep, but have less like discoloration, or not discoloration, I guess but the appearance of dark circles under the eyes is diminished when people get better sleep. You also feel like you look better. So when you sleep better, not only do you by objective measures look better, but you actually feel more confident in your skin if you have a good night's sleep. So all of these things, I am board certified in a specialty called lifestyle medicine, which focuses on lifestyle changes and how it influences our overall health. And those things are diet, exercise, stress management, sleep, avoiding risky substances. Of course, smoking, we didn't mention that, but smoking is a big one that really affects our skin long term. And then maintaining positive, healthy relationships, just being in a good place is really important for our overall health and even our skin health.
And what does the data say on alcohol? Because I think for so long there's been this argument that, mild to even moderate alcohol use could potentially be beneficial depending on the type of alcohol it is. But now we know, that may not be true. Can you tell us what the current data says about alcohol consumption?
Well, alcohol is a sugar, and sugar, as we know, glycates our collagen. So any high sugar diet or high glycemic diet is not good for our skin. We know that when it comes to acne studies, for example, high glycemic diets are associated with increased rates of acne. When it comes to alcohol and aging, I think that there's still lots of data to be done, but we definitely know that consuming high sugar drinks, like soda, for example, is definitely not good for the skin, and alcohol is a sugar. The other thing is that alcohol dehydrates our body. So every time we consume alcohol, we become more dehydrated. So overall, again, I don't know what the exact studies on this, but we can infer that, excessive amounts of alcohol wouldn't be beneficial for skin hydration. So there's lots of studies to be done when it comes to lifestyle factors in the skin. I'm actually writing a paper on that right now, so I'll have more up-to-date data soon. But we definitely are focusing on this a little bit more because we recognize in medicine that lifestyle significantly influences our skin.
And as far as diet, because I'm a big fan of adding in before you take away, because I think sometimes that can be really overwhelming for someone to completely overhaul their diet and stop eating their favorite foods. Are there maybe a handful of foods that you think are beneficial for skin health that people can start adding into their weekly diet or daily diet?
Sure, some of the data looks at diets high in vitamin C and linoleic acid. So diets high in vitamin C are things like, fruits and vegetables and so forth. And the other thing, and I do agree with you, you definitely want to add things in. So the other thing that we think about, and some studies suggest, like the omegas, our omega-3s are helpful. So those are what we see in fish, like sardines and salmon and so forth. So really, it's so funny because it's not like anything special. It's the things that we know are healthy. There's no magic trick. It's literally the things that we've known for years are healthy. Eating lots of fruits and vegetables, lean proteins like fish, healthy grains. Just a normal healthy diet is what's good for our skin.
Yeah, what's healthy for the body is going to translate to the skin. That's so interesting. Okay, so for someone who is battling hyperpigmentation, what are the essentials in their morning and nighttime skincare regimen?
So in the morning, the absolute essential is sunscreen, 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 sunscreen. It's like real estate where they say location, location, location. Sun protection is the most important, I think, aspect of a hyperpigmentation skincare regimen, because without sunscreen, anything else we do is useless or almost useless. So I recommend a sunscreen. I say the best sunscreen is the sunscreen you want to use every single day. So the best sunscreen may be mineral for some people, may be a chemical for others. It really depends on your personal preference. A lot of times people recommended tinted mineral sunscreens, and I do recommend that for more severe melasma patients because it is considered easier to tolerate. Mineral sunscreens are easier for sensitive skin, but also theoretically provide a little more of a barrier. But for your everyday patient with hyperpigmentation, I always say if you want to put it on every day, that's the best sunscreen for you. So as long as it's broad spectrum UVA and UVB, and it's at least SPF 30, I'm fine with it. Then if you want to go the extra mile, you might use a sunscreen that has some added ingredients to treat hyperpigmentation. You might want to use a tinted sunscreen because that protects us against visible light, and visible light has been shown to be implicated in hyperpigmentation. So there's some extra add-ons you can do, but the most important thing is sunscreen. Then in the morning, you can use a treatment product that addresses hyperpigmentation. So there are lots of serums and toners and so forth on the market that have things like tranexamic acid, kojic acid, azelaic acid, those types of ingredients that have been shown to improve hyperpigmentation. So in order, it would be to cleanse, use a treatment product, and then a sunscreen. And the best sunscreen is the one you want to put on every day. At night is when I tend to do the heavy lifting. So at night, you would use either one of those treatment products, but maybe a stronger one that you might not want to use during the day. One that's typically used at night is a product called cysteamine, but there are many other ingredients on the market. Tranexamic acid is a popular one, and there are some newer ingredients that are very exciting that are being used to treat hyperpigmentation. So I would do that second after cleansing, and then a moisturizer at night. If the person wants some anti-aging benefits when it comes to fine lines and wrinkles, they can use a retinol. Otherwise, they can use a moisturizer that also has ingredients to address the hyperpigmentation. So for me, one of the most important things is that at every step in the skincare routine, you're using products that are addressing the number one skin concern, which in this case is hyperpigmentation.
This episode is brought to you by, well, me. Skinthusiast.com is your one-stop shop for all things skin, hair, and beauty. I have countless blog posts to educate you on all the skin concerns and most common skin questions I receive. We also have a complete skincare basics guide on our shop page, as well as the cutest In My Skin era crew necks. If you want to support the show, please head over to skinthusiast.com/shop. And don't forget to rate and review the show wherever you listen to podcasts. And what are your thoughts on vitamin C? I find that I think it's a very efficacious antioxidant, but I think sometimes people expect more from it than it's able to provide, especially for things like melasma.
So vitamin C is an excellent skincare ingredient, and it's something that I use all the time in my skincare routines for my patients, but it's not a heavy lifter when it comes to hyperpigmentation. When it comes to hyperpigmentation, I look for different ingredients like tranexamic acid, kojic acid, niacinamide, azelaic acid, and some of the newer ones on the market like thiamidol and melasyl. So these are the things that I look for as heavy lifters when it comes to hyperpigmentation. Vitamin C can be a great adjunct, impact, but it wouldn't be my first choice as a primary treatment for hyperpigmentation.
And what are your thoughts on hydroquinone? Is it safe if someone has been recommended a hydroquinone prescription by their dermatology provider?
Yes, so I use hydroquinone all the time in my practice, but I use it less frequently now than I did, let's say, 10 or 20 years ago. So I use hydroquinone for patients with melasma because the good thing about hydroquinone is that it's a quick fix. So yes, I do think it's safe when used appropriately. So I use it for very short periods of time, maybe 4 to 6 weeks. So if a new patient comes in with melasma, they might get hydroquinone at night for 4 to 6 weeks, and then they'd switch over to a hydroquinone-free skin brightener. So in that case, I think it's excellent. Sometimes I'll use it for patients who have dark spots from acne that are very, very deeply pigmented, and they kind of just need to address those little dark spots specifically. And so again, that's very short. It works so quickly, you wouldn't need to use it for more than a month or two, and then switch over to a hydroquinone-free skin brightener. So those are the two instances that I use hydroquinone the most. I never use hydroquinone to the full face. It's only to targeted areas, and I only use it for short periods of time, so less than 2 months in my practice.
And that's the nice thing about these hydroquinone-free brighteners too, is they can usually safely, depending on the ingredient, be used all over the face for kind of overall brightening. Or do you still spot treat with some of these as well?
Those I feel very comfortable using it on the full face to even out the skin tone, and they tend not to change the person's actual skin color, but rather just even out the skin tone, normalize the skin tone. So with the hydroquinone-free skin brighteners, I do feel very comfortable with them, the patients using that on their full face, but I never use hydroquinone on the full face.
And you actually mentioned a couple of alternate ingredients that I've never even heard of. Can you kind of tell us what's kind of come down the pipeline in the last year? Because I know there's been a lot of activity in this space.
Yes, it's so exciting for me as someone who treats hyperpigmentation. This is really, really exciting. So I'm glad you asked this question. So thiamidol is a new ingredient. It's actually only available in Europe right now, but people are able to buy some of the products on Amazon. It is a tyrosinase inhibitor. Tyrosinase is an enzyme that's very important in the production of melanin. And most of the things that we use to treat hyperpigmentation are tyrosinase inhibitors. And it's very effective. I've used it quite a bit in my practice. And the other thing I like about it is that it's a lightweight serum, so it's not drying, it's not irritating, it's good for sensitive areas, like if someone has hyperpigmentation on their lips or in their underarms. And those are areas where we are sometimes hesitant to use stronger ingredients that are drying or are alcohol based, because that will cause even more problems. And so that's one of the huge benefits of that product, is I find it very safe for sensitive areas. And then the newest product on the market is called Melasil, and that ingredient is in a serum and also in a day moisturizer with sunscreen. It works in a different way. It actually binds the precursors of melanin, which are called the melanosome precursors. So how Melasil works is it binds the melanosome precursors, and it also has been shown to be very, very effective. So this is brand new. It came out in the last month. So I'm very, very excited to use it in my practice. Also very well tolerated, excellent side effect profile. We didn't talk about this, but even though hydroquinone is safe, it can be very irritating. So it's so exciting for me to get these new ingredients that are really helpful because they are not irritating. They can be used in sensitive areas.
And are there any actual product names you can give the audience for either of these ingredients?
Sure.
Anything you would recommend?
So the Melasil is La Roche-Posay's Melabee, and the thiamidol is the Eucerin anti-pigment product.
Awesome. That's amazing because those are both very affordable brands.
Yes, very exciting. And then in the space that's a little bit more prestige, I would say, and the doctor office space, there are some ingredients that are also very interesting. So one is called Path3, and it's a combination of peptides. And these peptides all kind of work in the formation of melanin, so they are inhibiting melanogenesis. And this is a great product, really good studies in all skin types. All of these, very importantly, have been studied in all skin types, because sometimes we'll look at new products and they've only been studied in skin types 1 through 3, which means their efficacy doesn't translate into skin types 4 through 6. So I get excited when I see studies in all skin types, because then I know it will work in my practice. So that is a great product, and that's the Elastin product and Illuminate. And there's another interesting ingredient called lotus sprout extract, and that's in Skin Medica's Even Tone product that also has really good studies. It's been shown in all skin types to help with hyperpigmentation.
Amazing. That's some really good tangible tips. And we obviously do have those in the audience who like the brands that they can get at their dermatology provider office. They love these kind of quote unquote medical grade brands. So it's nice that we have so many options here. Have you heard of Melasma by Mother Science? This is an ingredient that I recently came across.
Yes, so I have heard about it, and it's a relatively new ingredient, and it's based on something very interesting. So as you know, because we work together, there's a common condition called tinea versicolor, and it's caused by this yeast called Melasma. And this yeast has this interesting side effect that it can cause hypopigmentation. So people with tinea versicolor come in with little lightly colored or hypopigmented spots, usually on their back. And so I'm going to make sure I say this properly. So the researchers were able to isolate what causes the hypopigmentation, and that's what the active ingredient is in that product. And the studies have been published in really good peer-reviewed journals, so very excited to try that in my practice.
Yeah, it's really interesting. I was looking at the studies as well, and I was kind of turned off initially by the name of the ingredient for the reasons you just mentioned. But once I looked into it more, it is fascinating. It's just so interesting to see them kind of going down this rabbit hole and trying to figure out what could potentially be causing the hypopigmentation and then using it in a cosmetic formulation.
Yes, so I think it's fascinating because most of my career I've always thought if someone could figure out what this is that's causing the hypopigmentation and tinea versicolor, it would be a great skincare ingredient to use to treat hyperpigmentation. So those researchers were able to figure that out.
Yeah, so interesting. So for your skin of color patients, do you approach hyperpigmentation any differently than you do in your Fitzpatrick's 1 through 3?
I would say I do approach it slightly differently because I know it's a lot more challenging to treat. So for example, if I'm going to use hydroquinone, I might have to use 8%, usually I stop at around 8, but maybe even a little bit higher in my darker skinned patients. Compared to skin types 1 through 3, they can get away with a 4 or 6% hydroquinone. When I'm treating pigmentation, I might have to use something twice a day or stack products to get the best results because the melanocytes are more robust in the skin of color patients, and they're definitely going to be a little more challenging to calm down, to get them to stop creating that pigment. I always say that melanocytes are the factory that make our pigment, and my job is trying to turn off that factory so that we can minimize that hyperpigmentation and treat that hyperpigmentation. So if you have a really good factory that's producing a lot of pigment, a lot of melanin, it sometimes requires more active ingredients, more frequent application to get the best results.
And I think it's sometimes hard for the consumer to understand that, especially when it comes to melasma, it's a chronic condition that you'll, as you said, have for decades. So even if we can get you relatively clear, that's a win.
Yes. So I tell patients with melasma that and patients with melasma see this, that they get worse in the summer, better in the winter, worse in the summer, better in the winter. And I say my goal is to keep you down here instead of going up and down like that. So I set very realistic expectations. I also tell my melasma patients, the good news is that you won't have this forever. Most patients with melasma grow out of it and only have melasma, into their maybe at early 50s. Very rarely do I see melasma in 60s or 70s. And most of my patients will say, oh yeah, you're right, because my grandmother used to have this or my mother used to have this. So that's the good news about melasma, is that it definitely tends to go away over time, but you don't have to wait 20 years for it to go away if you develop melasma in your 30s. And we have really good treatments to manage it, to keep it under control. There's no quote unquote cure, so there's no one cream, one laser, or one treatment that can completely get rid of melasma forever, but we have really good effective products that can keep it under control.
And speaking of lasers, do you employ any lasers for your melasma patients?
I don't. As you know, we practice in sunny South Florida, I always say. So it's a really difficult climate, and we have such a high UV index. using lasers here is a little more risky than it might be in other locations. That doesn't mean lasers for melasma are bad. I think if you understand the risks and benefits, it could be a good choice depending on where you live and so forth. But where we live, it's pretty risky, and I have great results with skincare. So luckily, I don't feel like I need to use lasers. If I want to do an intervention, I might do maybe chemical peels or some other intervention, but laser is a little too risky for my practice, so I don't use it so much for melasma.
And when it comes to sunscreen, how often should we really be reapplying?
So with sunscreen, if you don't have a primary complaint of hyperpigmentation and you use a daily moisturizer with sunscreen in the morning, that should be fine. But what happens is if you have a long commute home in the sun, then you definitely need to reapply. So it really depends on, it's a very personal thing, depends on your personal life. So if you work from home and you're not sitting next to a lot of windows and you just put on your daily moisturizer with sunscreen in the morning, you should be fine. But if you live an hour away from work, you're driving home, you have melasma, then you definitely want to add in other things, reapply throughout the day. So you might, if you go for a walk at lunchtime, maybe you want to put some sunscreen on before you go for a walk, wear a hat, big sunglasses, and if you have an hour drive home in the sun, definitely reapply sunscreen before you get in the car. So it definitely depends on your personal lifestyle.
And for you personally, how do you reapply? Do you just use your same sunscreen lotion, or do you have any tricks, like do you use any of the compacts or the sprays or anything like that?
So for me personally, luckily I live very close to work and across the street. So I put my sunscreen on in the morning, and usually it's good enough for the day. But let's say I'm going for an evening walk, then I'll reapply. I don't really wear a lot of makeup, so I just put sunscreen on a second time. I also like sunscreen sticks for walks. Those I usually use a mineral stick because I can actually physically see the white, which I know some people think is bad, but when you're going to spend a lot of time outside, especially in the Florida sun with such a high UV index, sometimes for me seeing that white, for a fitness type of walk is very reassuring because I feel like I'm definitely covered. And then I also say don't forget just other sun protective behaviors. So wearing a wide hat, my patients who complain of hyperpigmentation and melasma almost always have a hat in their purse that they can take out, or a visor, big sunglasses that cover the cheeks, and staying in the shade when possible. So I do walk outside every day, sometimes twice a day, but I do try to walk at times when the sun is not out. So all of those things are things that can help.
Yeah, more is more when it comes to sun protection. So whatever you can add on, as you mentioned, the sunglasses, the hats, seeking shade, not being outside during those peak hours, anything you can do makes a difference. Okay, so switching gears a little bit to some follow-up questions. What is your holy grail skincare product if you had to choose one? I know this is a hard question.
You could already predict this, but it's going to be sunscreen. As I said, my number one skin concern for me personally is maintaining an even skin tone, and the best way you can do that is consistent, regular use of sunscreen. So the one thing I'll never skip, and even though I have the most simple skincare routine, the one thing that I will never ever skip is sunscreen. I feel naked if I'm not wearing sunscreen, so that's something that's very important for me.
And which one are you using at the moment? I'm sure you cycle through a lot of them.
I do cycle through a lot of them, so that's a good one. Actually, I'm using the new product by La Roche-Posay, that one that has Melasil. It has an ingredient to help with hyperpigmentation, so I actually just started that. That came out, less than a month ago.
Awesome. And what's your most underrated skin tip?
I would say my most underrated skin tip is to use your concealer to tint your moisturizer with sunscreen. So when I put on my moisturizer with sunscreen, I kind of dot my concealer all over. I'm not using it necessarily to conceal anything in particular, although sometimes I'll use it under my eyes, but I'm using it to tint my sunscreen. So I put a few dots of concealer all over my face, and then I put my sunscreen on top and mix it together. And it's a very simple way to get a tinted sunscreen that matches your skin color, because your concealer obviously is going to match your skin color.
Awesome. And very last question, if you could tell your younger self one thing, what would it be?
I would say keep using sunscreen. I was pretty good. I went to med school. I finished med school when I was 22, I think it was.
Oh, wow.
And
wow, you were young.
No, 26. Sorry. I finished undergrad at 22, med school at 26. And I would say probably from my the mid-20s, I consistently used sunscreen from that point forward. So I think, honestly, even though that's such a simple answer, that is probably the biggest predictor of skin health long term, is really avoiding sun on the face, for extended periods of time over decades. So, I was 26 then, I'm 51 now, and I would tell myself, keep using sunscreen, don't skip it. But I was pretty good. Maybe I would have started when I was a little bit younger, I could have gotten a little extra benefit.
So I have to mention also, I have been really enjoying your newsletter. So as I mentioned, every time we speak, I learn something new. And you have a newsletter where you kind of break down what's up and coming in skincare, what's new. Is this a newsletter that anyone can join, or is it only for medical providers, or who is it geared for?
So it's a newsletter designed for skincare content creators and skincare experts. So if you have an interest in skincare or you love skincare, it will keep you up to date on everything that's new. So in the newsletter, it kind of has 3 separate sections. So the first section is skincare news, and I curate all of these different sites and figure out what would be interesting to someone who's creating content or who really just wants to stay up to date on skincare. So the first section has 2 news articles. It's every week on something that's new that's happening in skincare. And then the second section talks about skincare trends online. So usually I focus on TikTok. So what's trending on TikTok, whether it's a trending sound or a trending concept or something that would be great to stitch. So if you're always looking for ideas for your skincare content, there is a section that gives you a couple ideas that you could integrate that week into your content calendar. And then the last section is really interesting. It shows the top 10 sellers at Sephora, Ulta, and on Amazon in skincare. So I like that section because it kind of keeps you up to date of what's trending, what's not trending. Usually those top 10 are pretty static, but every once in a while something new will come onto the list, and it kind of keeps you up to date on what's trending in skincare as far as sales. So it has those 3 sections, and it really is kind of this comprehensive. I came up with this newsletter because it was the things that I would be most interested in. What's new in skincare news, what's trending online when it comes to social media, when it comes to skincare, and then what's actually selling, on these major retailers like Amazon, Ulta, and Sephora.
Yeah, absolutely. That's just invaluable information for somebody who creates content about skincare. Each one of those sections is just, that's incredible to have that information at your fingertips and not have to go chase it. So is that free for everyone to join?
It's free for everyone to join. It comes out once a week, usually on Tuesdays. And yeah, I'd love for anyone who's interested in joining. It's really fun for me to create. I love learning, as you know. I'm always so excited to see the news and say, oh my God, I didn't know that, or I didn't know this just launched. And so, people who create content or skincare experts or anyone who just loves skincare will really enjoy the newsletter.
And where can we sign up for that?
At dermfriends.com. The newsletter is called DermFriends, which is my website that's really all about skincare. It has some skincare recommendations and blogs, but the newsletter can be found on dermfriends.com.
Awesome. We will link that below. Well, Dr. Woolery-Lloyd, thank you so much. You are one of the busiest people I know, so I really appreciate you taking an hour to chat with me today, and I know the audience is going to love this episode.
Thank you so much. Thank you so much for having me.
Of course. I hope you guys found that episode so enlightening in the way that I did. The couple of ingredients that she mentioned that are coming down the pipeline, or I guess have already launched for hyperpigmentation, were completely new to me. So as I mentioned, I learned something new every time I talk to her. I'm going to leave links to the major products that she spoke about below. And if you've ever dealt with hyperpigmentation, you know how exciting this is, because whenever we have a novel ingredient that could potentially help us in this fight against hyperpigmentation, it's so helpful. But there were tips for absolutely everybody in this episode. I really encourage you to sign up for her DermFriends newsletter because I learn something new every time I read it. Again, I'll leave that link below. And you can also follow her on socials. I will leave a link to all of those below. Thank you so much for listening. If you have a second to rate and review the podcast, I like to pick some people who have left reviews on either Apple or Spotify to send a little skin enthusiast box to, just to show my appreciation. So again, thank you so much for being here. Be sure you subscribe, be sure you rate and review the show so that we can get to more ears of more skin enthusiasts. And I'll talk to you next week.